I talk about viruses and mentioned that viruses have, let's do it this way, that's a little better I think for you guys to see. Viruses have one goal overall, and when I talk about a virus, I'm basically talking about a sequence of DNA that's encapsulated by some combination of protein and other materials. But this sequence of DNA, its one goal is essentially to spread itself, to make copies inside whatever it's inside of, and to spread and to make as many copies as possible. So if I were to say, like, or if you were to wonder or to think about what the goal of a virus is, I would say essentially it's what you could say it in one word: it's to spread. And there's a lot of different ways that viruses can spread, and so I figured a good way of talking about it would be to look at two kind of sample viruses, and I tried my best to pick two viruses at opposite ends of the spectrum so we can get a sense for how these things behave. At one end of the spectrum, we have the Ebola virus. Also, if you guys have any questions, you're welcome to type them in the chat, and I'll be checking it repeatedly, so I'll try to handle them as they come up or when we get to a good stopping point. So Ebola virus, you get Ebola, you fall very ill, you might start puking blood, and as far as illnesses from viruses can go, Ebola is just about as bad as it gets. The case fatality rate for Ebola is around 50%. That means if you get Ebola and you get infected with it, it's essentially a coin toss whether you live or die. And that is horrible for you individually. You know, you start puking blood, everyone's like, oh, you know, and that's a horrible thing. However, it's because Ebola is so bad for you as an individual that from a global health perspective and from a worldwide perspective, it's actually, sorry, my phone went off. It's actually less dangerous from a global health perspective. Let me explain to you kind of why that's the case. Say you get sick with Ebola, right? You're walking down the street, oh my gosh, I suddenly feel awful, I'm going to start puking blood. Chances are people around you will say, hey, that person looks really sick, and what will they do? Not go near you, stay away, they might do their own thing, and so as a result of that, if you're the Ebola virus, it's actually very difficult for you to spread from one person to another. Your family and whatever who are close to you, that's one thing. But people out in public, it's actually much more difficult to spread because as soon as you get sick, you're most likely to be bound to your bed or to be separated from other people because it's very obvious that you're sick. And so as a result of this, in the largest Ebola outbreak in 2016, I think it's the largest Ebola outbreak that we've seen so far, there were only about 28,000 cases in Africa, mostly. So as a result of that, you take into account the fatality rate, and that's 14,000 deaths. And that is a lot of loss of human life, but on a global perspective, that's only a small drop as far as things go. And so the big point I want to make here is that when a virus is very dangerous for you as an individual, frequently that leads to it being less contagious to other people because when you are ill, you're often isolated and not in a position to spread the virus to other people. At the other end of the spectrum, we have the common cold. And the common cold is at the complete opposite, I would say, of the Ebola spectrum. What do you say if you get a cold at school? Oh, Mr. Mulwan, I have a cold. I'm not feeling that great, but I'm here at school. You know, it's fine. I'll push through it, and I'll be okay. I can function. And we'll say, oh, I'm sorry. That's bad. I hope you get over it. Individually, we would say the cold's not really that bad. Most American adults get colds about twice a year. But if you think about how many people are in the US is about 300 million people in it. And so if you consider maybe like all of the adults getting it twice a year, that's over 200 million cases of the common cold every year. 100 million adults, twice per year. That's a huge amount. And so to give you guys a sense of, this is a virus that is not very dangerous on an individual level. Maybe you only miss 2 days worth of work, but because it affects so many people, it can be really, really devastating on a global perspective. This is a war poster from World War II, I believe, and it estimates if you have 10 million people in a particular industry and they each take 2 days of work off for a cold, that's 20 million work days, and that's the loss of essentially 50,000 jobs in a year. And so that is a big deal. And so one thing I want to make clear to you guys is that a virus that is individually not that bad for you can be a tremendous deal on a global scale because of the amount of people that it affects. For example, if you consider 1% of 100 million people, that is still 1 million people, and that is almost 100 times more than the people that died in this Ebola outbreak. Okay, what I want to make clear here is that there's really two kind of, Roy and Rami are, hi Roy, hi Rami. What I want to get to here is that there's essentially two conflicting virus strategies. The first virus strategy is what I would consider like an Ebola style strategy. It's a very effective short-term strategy. It basically says, okay, I've entered a human, like I've entered a host, I'm going to spread as much as possible in that host at any cost. If the person has to die in order to make me spread, so be it. And while that strategy is very effective in the short term, wow, I'm doing really well. I've spread everywhere in this human being. When it comes time to spreading to other human beings, that can be less effective because when you kill your host, you obviously don't have any way to spread to other people. That person's buried in the ground, and then, oh no, I'm kind of stuck. On the other hand, you can think of another strategy for a virus, kind of like this common cold style strategy, and it's a much more sustainable growth strategy. It's basically saying, okay, instead of killing my host and spreading as much as possible, I'm going to grow slowly by being annoying, by being minorly annoying, but for a really long period of time. And so, as a result, this person's going to school, and what are they doing? They're potentially spreading the virus to other people. And so, this virus, even though it doesn't use that many resources in the short term, over the long term can end up using a lot more because it's just been alive in the host for so long. However, if you are a common cold and you are in an individual that also happens to have, say, Ebola, for example, most likely you're going to be outcompeted. In other words, the Ebola virus is going to steal all the food that you wanted from the human being or from the host, and so you might not be as successful in the short term. So you can think of these two strategies as providing like opposite ends of a spectrum, and the most dangerous viruses for humanity on a global perspective are often the ones that do both of these things pretty well. In other words, they're pretty effective at spreading inside a person that they're inhabiting, but also they're really good at spreading to other people. And that is typically what makes for a very dangerous virus from a global health perspective. Notice that from an individual perspective, that's not necessarily, it doesn't look that bad because you might say, oh, wow, this isn't even that bad of a sickness on an individual level. But when you take into account how many people are affected by it, that gives you a sense, or that starts to give you a sense of how dangerous it is overall. That brings us to COVID-19. COVID-19 is a novel coronavirus, novel meaning it's the first time we've experienced this virus in humanity. It just made its way to humans from bats. We know that because the virus's DNA sequence it's been sequenced, and so DNA kind of has fingerprints, and so it has many of the fingerprints or signatures that the bat virus does. And the case fatality rate for coronavirus, I pulled this from a paper that was published, I think June of last year when it first started to originate, what was estimated somewhere between 0.25% and 3%. And you might see that and say, well, that number is really low. For example, the flu's fatality rate is only 0.1%. So you could say, okay, this is a little worse than the flu, but it doesn't seem that bad. That number seems low. It's not 50% like Ebola. The most dangerous part, I would say, of this virus is that it has a lengthy incubation time. In other words, it can sit in you for, I think the average incubation time is 5 to 7 days, but it's not unusual to see it as up to 11 to 14 days. What this means is, say today I get infected with the virus. Maybe like I stab myself in the hand or I breathe in some stuff from someone else, and oh my gosh, I've gotten some coronavirus. This means over the next 5 to 7 days, most of the time, I'm going to appear perfectly healthy. And I'm not feeling sick. I'm actually feeling fine. So why do I need to stay inside? I'm going to go outside and I'm going to go grocery shopping. The problem is, because I'm infected and because it's been shown that some of these people can infect other people, even though I appear healthy, I'm spreading the coronavirus, or I could potentially spread the coronavirus to anyone I meet that day. And so it's this lengthy incubation time where people appear healthy but could potentially spread it to other people that makes the coronavirus particularly dangerous. This is not the first time we've seen coronaviruses as humans. We've also experienced some other coronaviruses in the past. If you've heard about SARS, if you've heard about MERS, I think this came from China as well, and this one came from the Middle East. We've experienced coronaviruses as well. Oh, Rami's waiting again. Okay, so this thing sits in you for a long time before you can get sick. You could potentially spread it to other people. Well, that's kind of a big deal. But why is this so bad? On a global perspective, when a virus is novel, in other words, the first time it makes its way to humans from another species or something like that, it is really, really bad. Why is that? First of all, no one's gotten sick from this virus before. And so as a result of that, when you get sick from something, you fall really ill, and then you get better, and your body now has a natural kind of immunity to viruses of that type. That's why the flu can spread in a given year, but it doesn't affect everyone because some people may have gotten a similar flu to that in the past, and they might be immune to it. However, with a novel virus, no one really has built up an immunity to that because it's the first illness of this kind. It's the first virus. It's the first pathogen of this kind. And so as a result of this virus has the potential ability to spread through everyone in our population because no one's gotten it before and no one's kind of built up an immunity. As a result of that, you've seen some tremendous growth in coronavirus cases. You have to make sure to look at the scale in this diagram in terms of what's going on here. For example, China, Italy, US, you can see, especially at the very, very beginning of the curve, there's a very, very steep rise. It's almost an exponential rise. And that is terrifying because that means at the given rate, the virus or the number of virus cases approximately doubles every 2.5 days. What that means is if I were to get infected today and then to wait 10 days to see a doctor, in that time, the amount of cases with coronavirus would have multiplied by 16. It would have doubled 4 times. And so by the time you're sick, and by the time you look sick, and by the time you go to the hospital and you're sick, in that 10 days or in that 14 days or in that 7 days that you've done it, potentially many, many, many more times or many, many more people have gotten infected in that time. And so by the time you notice that people are getting sick, if we were to shut things down, it could essentially be too late. One of the kind of theories behind these preventative measures we're doing, one way to think about it is if you have a fire in your kitchen. When the fire is still small, you can take a fire extinguisher and put it out, and chances are you're going to be okay because it hasn't spread that much yet. But if you wait till the fire lights your whole kitchen on fire, there's nothing that your fire extinguisher will do. And that's one of the reasons that we're trying to be so proactive about this virus, is because this incubation time and because it doubles very quickly, because it's so contagious, we really need to be preemptive and take the fire extinguisher to the fire before we can even see that it's a really big issue. We need to make sure to nip this thing in the bud before it really gets out of hand, because once it's out of hand, there's very little we can do to slow the amount of cases that are growing. Okay, so the fatality rate for COVID-19, let's estimate it maybe around 1%. That puts it at 10 times more fatal than the flu. Is that really such a big deal? Well, all right. Let's talk about American hospitals. American hospitals have around 975,000 beds. That means if 975,000 people got sick in all the right places in the US and they were all able to get to a hospital, all those people would have the care of nurses and doctors, and they would have the maximum chance of getting healthy again. In other words, maybe 99% of those people would get better or 1% of those people would potentially die. Okay, and that's all fine and well, but if you consider that maybe 15% of people are getting hospitalized, That means if 15, or let's say if 7 million Americans get coronavirus, 15% of 7 million is around 1 million. And that means we will potentially fill every single bed in an American hospital. How many people live in the US? Does anyone know? Rami, what you got?
330 million.
Yeah, let's say 300 million, just to pick a round number. Okay. At the moment, if we do nothing about it, the coronavirus could potentially reach, we'll say, 40 to 60% of the US population. That means potentially you could be looking at 150 million people infected. And if only 1% of those people go to the hospital, that's still 50% more than would reach, than our hospitals could handle. And so as a result of that, it's a big deal to try and cut down and to slow the spread so that our hospitals don't get overloaded with the amount of people that are there. As a result of that, I don't know if you've seen this hashtag of flatten the curve, but one of the most important things we can do overall is to slow down the spread of coronavirus. It's not to prevent you from getting sick. Actually, chances are about half of us will be infected with the coronavirus. It doesn't mean we're going to get sick. It just means we'll have the virus and potentially get better. However, the thing that this does is it slows down how many people are getting sick at the same time. To give you a sense of that, when people stay at home, or if you isolate yourself, or if you're not going around, if you think about this fire as a disease or a virus that's spreading and someone were to step out of the way, it can potentially do a great deal to slow or to stop the further spread of the virus. And so as a result of that, there's a lot of kind of press and social media action to flatten the curve. Again, because the biggest catastrophe that will happen with regards to this is if our hospitals were to be overloaded. And if our hospitals are to be overloaded, then it's bad news because you could get sick, maybe you get into a car accident, maybe you break an arm or something like that, and you go to the hospital and there's actually no space for you to get better. And so these things that are very preventable and curable on a daily basis, when hospitals are full, suddenly become much bigger problems. Okay, to give you an idea of flattening the curve, Rami, you got a question for me?
I was just wondering, did I miss any intro, anything important, like what I missed?
We talked about some viruses. I've posted this is currently streaming to YouTube, and I'll post a link to the stream afterwards, so you should be able to catch up on the first couple of minutes of that.
Thank you.
You're welcome. Okay, so if you consider that our healthcare system has a certain capacity, that's this constant line across the top here. Many times, the progress of a disease, you'll have a big spike in cases, you'll hit a maximum, and then people will start to get better faster than they're getting sick, and you'll see it drop back down to zero. If we were to do absolutely nothing to help ourselves, and the most people would get sick the fastest, that could potentially lead to a very large spike of people. So a lot of people are sick at the same time. And if a lot of people are sick at the same time, and more people are sick than our healthcare system has to take care of, then potentially all of these people could be at risk of, dying, essentially. And so as a result of that, all of these social measures for hand washing, hey, don't touch your face, hey, don't gather in large groups, hey, don't do the social distancing stuff. The goal of that is not to prevent you from getting sick. Actually, in the second graph, the area is about the amount of people that get sick. So you can see that about the same amount of people are getting sick in both of these cases. It's just that in the second case, the people are getting sick spread over a longer period of time. And it's this longer period of time that gives our hospitals and our healthcare system the time to catch up. You can actually see here in the second case, there's actually only a small percentage of people that are sick without the ability to see the hospital. And so that's much better for us as a society because in the first case, you have a large percentage of people who are at risk without proper medical care. And in the second case, you have a much smaller number. And so by social distancing and by washing your hands on a regular basis and by doing all these crazy, unprecedented kind of changes to our social lives, we are doing this as a society to help our healthcare system out and to make sure our doctors and our nurses and everyone in the healthcare system that can take care of these sick people can catch up and make sure that they can do this without getting overloaded. Okay, so if there's one thing I can encourage you guys to do, please, please, please do not take this casually. That is a catastrophe, not for necessarily ourselves as individuals. Actually, people under 20 years old, I think only 1% of the COVID-19 cases are from people of your age. So for the most part, if you guys were to get COVID-19, you're not going to get sick, or you're not going to be seriously ill. It will probably be not worse than the flu, all odds or all chances and likelihood. But people that are elderly, people with prior existing health conditions, those are the people that are at risk. And when you are a person who could potentially be infected and spreading it to other people, that is the big danger here, is because you could spread it to someone who has much less susceptibility than you. Your parents, your grandparents, other people that you work with or that are at school or that they work with. That is the big danger here, and that's the reason that we're going through all these measures here. It's not for yourself. It's for other people. It's for society overall. Okay, just one last thing. It's tempting to look at the case number in the US and say, hey, there's not a lot of people sick. Therefore, we don't have to act now. Already I've mentioned that because the incubation time is so long, that's not necessarily the case. The people that are sick now are essentially the people that were infected 10 days ago or 14 days ago. On top of that, we also have to consider that as a country, we are testing way, way, way less people than most other developed countries. This is the amount of tests for COVID-19 performed per million people. South Korea, where there's a big outbreak, is probably the most unprecedented societal organization to test on a regular basis. They test about 6,000 people per million people. This is as of yesterday, or 3 days ago, sorry. On the other hand, in the US, we're testing less than 1/50th of that number with 125 people or tests per million people. So I would guess that most likely the number of cases that are being reported for COVID-19 are being drastically underreported in the States because there's just not enough tests available for us to get an accurate sense of how many people that are infected. So as a result of that, please be careful, because saying you don't have coronavirus because you haven't been tested isn't something that we really want to be doing on this level, right? It's actually extremely risky and dangerous. And so from a global health perspective, we just need to be aware of the fact that as a country, we've not really tested that many people overall. And so it's a lot harder to get a sense. You can still make estimates of it by taking or by calculating some stuff. We'll be doing that a little bit later. But it is a lot harder to get a sense for how many people are ill in the US because it's most likely being underreported due to the lack of tests available. Okay, all right, so that's all I got for you guys today. I hope that's helpful. What I'd like to do with the remaining time is if you guys have any questions, which I think is really helpful because I'm sure you've read some things and you have some questions to ask. I can't guarantee that I will have an answer to every question, but I'll try my best based on what I've learned over the last couple days and what I've seen. Also, as well, I will post to Blackbaud. I've done a fair amount of research into COVID-19, so I've published that in this document right here, if you guys can see that. Almost everything is cited. So if you look here, like this one right here, has some evidence about that, and then it has a source for that from the CDC. I tried my best to stick to really reputable resources for that. So if you are interested in this and you want to look at it further, this should be a really good place to start. I've tried my best to pick very good sources for this and stay away from social media as far as that is. All right, so any questions, you're welcome to type them in the chat or ask questions here. All right, Robbie, go for it.
So for social distancing, should it be like complete isolation, you think? Or if we see one person who's also been at their house, it's fine?
Okay, so you have to think of this as a spectrum. It's not like if you go see someone, it's completely horrible, and it's not like if you stay in your house, it's completely good. Generally speaking, our goal is to minimize the amount of opportunities this virus has to spread to other people. So any interaction you have with other people is going to increase that risk. However, if you're interacting with small groups of people, that is much less risky than interacting with, say, lots of people. For example, if the whole school were to go to a kihila, only one of those 200, however many people, has to be ill to potentially spread it to every other one of those 200 people. In a group of 5, your odds are much lower, if that makes sense.
Mm-hmm.
So I will also say I was chatting with I have a good doctor friend of mine. He's a emergency med physician in Charleston, and he mentioned that really, in order for social distancing to be effective, he's saying that it needs to be pretty extreme in order to make sure our healthcare system doesn't get overwhelmed. That's not to say that it's not going to help. It will certainly help. Whatever you're doing to social distance and things like that will help. However, the more we can stick to it and overall as a society, the better it will help. If you'd like a visual of this, Rami, this article by the Washington Post right here in this article is really, really good. It has a very simple model of how the disease spreads. These brown dots are people that are ill from the disease. So you can see here with one and no quarantine or no social distancing, it actually spreads quite quickly. You can see it peaks very quickly and then people start to get better. But if you quarantine, like you basically lock everyone in one place, that can slow the peak. Do you see how we don't maximize at the same amount of time? And if you social distance and have people stay still at home, you can see actually that it spreads extremely slowly. So social distancing can do a really good job of slowing the amount of people that are getting sick. Just because not all of these dots are available to move around and infect other people. So you can see here, in any society, it's impractical to expect everyone to social distance. Some amount of people going around to do deliveries and things like that needs to happen. But you can mitigate a lot of this dangerous rapid spread of the virus by social distancing from each other. And you can see here, with even less people social distancing, now your rise is much, much shallower. So this, if you compare the last graph to this one, makes a big difference in terms of how many people are getting ill and things like that.
And where do they think we are right now, like compared to all those? Like, obviously not everyone's social distancing, but we have a good amount of people, so it's slowed. Has it flattened the curve a little bit already?
Okay, so here's the thing. It will not flatten the curve for at least 10 to 14 days. Okay. Because the people that are getting sick now are the people who were getting infected 2 weeks ago when there was none of this stuff going on, right? So really, to see how effective it is, we need to wait 10 to 14 days and see if there's any slowing in the exponential curve. So you look at this one here in this graph in the US. We're currently it's exponential, like basically it's growing very rapidly. Italy, exponential. China, you can see tailed here, right? And that's where you can see, okay, if it's tailing around this state right here, that means 2 weeks beforehand, whatever measures around that time would be the ones that you might predict to have some sort of effect on the slowing the growth of the virus overall. So it's really hard to say for this time. I mean, almost certainly it will slow the virus's growth. The only issue is in the remaining time that people have been getting sick, we just need to make sure it's not spread to a significant amount of the population. Other questions?
I have one. Or Bobby, you go. You go.
Okay, Bobby, then Harris.
How did Corona start?
Eating bats.
Okay.
Mm-hmm. So there's some wet markets in China. So the most likely source of the virus is thought to have come from wet markets where they'll keep these animals there, and then they'll keep them for eating essentially. And so the animals are live in those wet markets. And so as a result of that, when animals are live, right, this virus is transferred through respiratory droplets. So you cough, you spit out some mist, with some germs in it. Well, if you have live bats around you, you don't normally have live bats around you. So that creates an environment where bat germs and bat respiratory droplets have the opportunity to mix with humanity in a much higher proximity than they normally would on a daily basis. And so a lot of those wet markets have been identified as sources for viruses.
I was completely joking. Didn't know that was the real reason. I'm shocked.
Harris, what you got?
On mute. There's a big thing with like sports and like all these NBA players. It's been coming out in the past couple of days that like Kevin Durant has it. So you think they got it like 10 days ago when they were still playing like normal?
Oh yeah, without a doubt. Like, I mean, this thing incubates for on average 5 to 7 days, or the median time is 5 to 7, but like around 11 is pretty reasonable. So if you're starting to get sick now, then chances are you got it a week to 2 weeks ago, like most likely.
So do you think that like these sporting events will come back in the next 2 months after that, like in the summer?
Okay. In terms of, can you predict how long we'll have to do the social distancing and things like that? When will life go back to normal? It's really hard to say. The biggest factor that will affect this is how well, as a society, we do with social distancing and keeping things apart and making sure to minimize the spread of this. If we do that and we see the curve start to go down again, then most likely we can ease up on some of that social distancing.